Hi, students. I am just going to go through briefly the answers. So, number one, it should have been disease. Two is procedure. Remember, PCS is inpatient procedure. You won't have to deal with that. And one thing you can do, you can always abbreviate this, so keep that in mind. Number three is ICD-10 CM PCS. Number four, the intent of ICD-10 CM describe the clinical picture or findings of the patient. Number 5, 7, we have 7 characters. For ICD-10, you can have 3, but it can go up to 7. 6 is tabular. Remember, you look in the alpha and then you double check in the tabular. 7 is HIPAA. 8 is medical necessity. This is a really important definition to remember. Um, it is one of your standards to know, so make sure you review that. Number 9, face-to-face encounter. This is face-to-face contact. This is called encounter. And 10 is value. Now I'm going to go through exercise 6.8, the coding guidelines. The first one here is cooperating. Number 2 is the National Center for Health Statistics. Boy. Number 3 is HIPAA. 4, encounter. 5 is providers. All right, so now let's go to 6.8b. Let's go ahead and look at this. The physician treated the patient's chronic asthma during an office visit. At that time, they renewed the prescription for diabetes, hypertension, high cholesterol were provided. Okay, so what is the first listed diagnosis? It should be the asthma because that is why they came in for that office visit. Yes, they had the rest checked, but again, they came in because of their asthma. All right, number 2, same thing here. Rule out cholecystitis. The patient presented to the office with severe abdominal pain. Remember, I kind of talked about that. During the encounter, the nurse performed a venipuncture for an ordered blood glucose test. The answer is A. They came in for abdominal pain. Since we're outpatient, we cannot code that. Anything to rule out. And these are procedures. These are not diagnoses. Okay, number 3. This one here, the patient slipped on ice, fell while walking down the steps. Patient was treated at the ER, again outpatient, for severe swelling of the left leg. X-ray was negative. All right, what is the diagnosis? It is going to be swelling. There wasn't a fracture, slip on the ice, falling down. Those are going to be external codes, like how did they do it? But once again, these are not actual diagnoses. Number 4, presented with a fever, treated for nausea and vomiting. The physician diagnosed them with gastroenteritis. So what is that diagnosis? Okay, so the fever, the nausea, and the vomiting are all integral to this gastroenteritis. So as a MA, you're only going to code the gastroenteritis because everything else is integral. It's a sign or symptom of that, so we do not code that. Okay, number 5. This one here, the patient was treated in an outpatient encounter for a sore throat, which was cultured. And the physician, here we go again, this possible strep throat in the record. Okay, we cannot code strep because of the word possible. If they took that word possible out, the physician documented strep throat, then we could code strep throat. So this one here is going to be B, just sore throat. Number 6, the patient was treated during an outpatient encounter for both acute and chronic bronchitis, for which was assigned ICD-10. Upon examination, wheezing, rales were documented. Okay, outpatient for both acute and chronic bronchitis, you are just going to code the acute. Number 7, they have acne during the encounter. Physician documented that the previous diagnosed hives was totally resolved. Okay, so they're coming in for acne. That's what they're being treated for. You are going to code acne. Acne treatment is going to be a procedure. Okay, again, we are looking for a diagnosis. Number 8 is going to be they come in for fainting. They said they have previously experienced nausea and vomiting. The patient's blood was drawn. A blood glucose level was performed. Labs were performed. Patient was scheduled for outpatient testing to rule out seizure disorder. So what is going on here? Okay, we have to go with fainting. They had experienced nausea and vomiting. They did some blood work. It was all normal. And we can't code seizure disorder because, once again, we need more testing. Okay, it says rule out, can't code that. So our code for number 8 is going to be fainting. Number 9, they came in for an outpatient radiation treatment. So they came into the office for the prostate cancer during today's encounter. They have previously complained about painful and bloody urination. Once again, why are they coming in today? Coming in today for that prostate cancer. And number 10, pre-op diagnosis was possible appendicitis, right lower quadrant pain. They did have an appendectomy done. The post-operative diagnosis was acute appendicitis. So yes, that's what we're going to code. It doesn't say possible appendicitis or anything like that. They did have it.